Although the world struggles to battle the coronavirus pandemic, did you know that there have been many near pandemics in recent years? In reality, some of the diseases that came close to killing people were much more deadly than COVID-19. If any of these diseases had gotten beyond healthcare workers' grasp, the consequences may have been much worse than COVID's. Here are 10 pandemics that have killed more people than the coronavirus. Number 10. Measles. Coughs, sneezes, and contact with nasal secretions spread the measles virus, which is a highly infectious airborne disease. Symptoms usually appear 10 to 12 days after exposure and can last up to 7 to 10 days. A high fever, cough, runny nose, and inflamed eyes are the first signs of the illness. Koplik spots may appear 2 to 3 days after the onset of these symptoms. These are tiny white spots that occur inside the mouth and resemble salt grains near the molars. The measles rash appears in the face after the formation of Koplik spots and spreads to the rest of the body. Some risks from the infection include pneumonia as a result of measles-induced immunosuppression. Measles was declared eradicated in the Americas in 2016, but cases have been recorded since then. In 1991, there was a measles epidemic in Philadelphia, with 1,400 people infected and 9 children dying. The Faith Tabernacle Congregation Faith Healing Church, which prevented members from getting vaccinated, started the trend. Number 9. Whooping cough. Since the disease's symptoms can last up to 10 weeks, whooping cough is also known as the 100-day cough. Whooping cough is a highly infectious bacterial disease transmitted by suspended water droplets released by infected people as they sneeze or cough. The disease's first symptoms are similar to a common cold, but they are quickly accompanied by weeks of violent coughing fits. As the individual breathes in after a coughing fit, a high-pitched whoop sound can be heard, hence the name. Some people with whooping cough vomit or break ribs as a result of their coughing fits. Symptoms usually appear 7 to 10 days after infection. Infections can happen even if you've been vaccinated, but they'll be milder. Each year, approximately 61,000 people die from whooping cough, which affects 16 million people mainly in developing countries. The majority of cases today arise in developing countries due to a lack of proper health care. While outbreaks have decreased dramatically in the United States after the widespread use of vaccines, some outbreaks did occur in the early 2010s. Following a doctor's misdiagnosis, an outbreak in California resulted in nearly 10,000 cases and 10 child deaths. Experts believe that this epidemic, as well as others, is largely due to people avoiding the vaccine for non-medical purposes. Number 8. Typhoid fever. Typhoid fever is a bacterial infection that can be borne and transmitted without causing any symptoms. The disorder is characterized by a high fever, as well as stomach pain, headaches, and constipation. Some patients develop skin rashes with rose-colored spots as a result of the disease. The bacterium's growth in the victim's blood and intestines causes these symptoms. In 1906, the notorious Mary Mallon, better known as Typhoid Mary, was involved in the most famous epidemic of typhoid in the United States. Mary is considered to be the first asymptomatic carrier of typhoid in the United States. In her job as a chef, the Irish immigrant contaminated an estimated 53 people. Authorities quarantined her, but she returned to her job as a chef before being forced into forced isolation for the last 30 years of her life. The vaccine, which is between 40 and 90% effective in preventing transmission of the bacterium and can last up to 7 years, played a major role in the epidemic's end. Number 7. Swine flu. The 2009 H1N1 virus, also known as swine flu, is a strain of influenza that triggered a global pandemic that lasted 11 months. The Spanish flu and Russian flu pandemics were both caused by this influenza virus strain. The disease gets its name from a virus made up of genetic material from a variety of duck, swine, and human flu viruses. The name of this new virus comes from combining its genetic material with that of the Eurasian pig flu virus. It has effects that are similar to the flu, and World Health Organization experts believe it is not as deadly. It's impossible to quantify the exact number of cases during the pandemic, because of the unknown number of asymptomatic cases. But experts estimate that it may range from 700 million to 1.4 billion. The estimated death toll ranges from 150,000 to 575,000 people. By contrast, the flu kills between 250,000 and 500,000 people per year. Number 6. Cholera. Many citizens are unaware that a cholera pandemic has been raging in many developing countries since 1961. Cholera is transmitted mainly by the consumption of water polluted with feces. As a result, people in third world countries are at greater risk, while cases in developed countries have declined sharply in recent years as sanitation has improved to an all-time high. An infected person will die within hours if cholera is not treated. Diarrhea, vomiting, thirst, and dehydration are common symptoms that appear anywhere from 2 hours to 5 days after exposure. The most recent cholera epidemic in the United States ended in 1866, with up to 1/10 of the population of major cities succumbing to the disease. The most effective way to combat cholera is to provide proper sanitation and safe drinking water to at-risk areas, as well as to use cholera vaccines selectively when necessary. Number 5. SARS. In the early 2000s, the SARS, severe acute respiratory syndrome, outbreak swept the globe. The virus's first outbreak was discovered in China, and it quickly spread through East Asia and as far as the United States. During the epidemic, about 8,000 people were infected with SARS, with nearly 1,000 deaths. Fever, aches, diarrhea, and pneumonia are all symptoms of SARS. When an infected individual coughs or sneezes, the infection is spread by bodily droplets, which can be inhaled and infect others. The media dubbed SARS the first pandemic of the 21st century. SARS had a much higher mortality rate than COVID-19, with 10% of those who were infected dying during their disease. During the pandemic, the World Health Organization and the Centers for Disease Control and Prevention worked hard to limit travel and contain the virus as much as possible. In the end, only 8 cases were recorded in the United States, and interventions were effective in preventing a large-scale outbreak in North America. Number 4. Polio. The poliovirus causes poliomyelitis, which is an infectious disease. Polio is transmitted by ingestion of contaminated feces or, in rare cases, infected saliva. The vast majority of polio patients have no symptoms, and only a fifth have mild flu-like symptoms. In around 1 in every 200 cases, the virus spreads from the gut to the central nervous system. Muscle fatigue, most often in the legs, results as a result of this. Muscle fatigue may also affect the muscles of the head, neck, and diaphragm, requiring the use of an iron lung in extreme cases to maintain normal breathing. 2 to 5% of children and 15 to 30% of adults die in victims that have any degree of muscle weakness. The first polio epidemic in the United States occurred in 1894, and major outbreaks occurred in the first half of the 20th century. Polio had a huge effect on America and public health, with President Franklin Delano Roosevelt being the most well-known example. Polio was at its height in the United States between 1916 and 1955, when the Salk vaccine was approved. There were 57,628 cases registered in 1952, with 3,145 deaths. In 1994, polio was declared eradicated in the Americas, and recent vaccination campaigns have helped to eradicate the disease in many third world countries. Number 3. Ebola. Ebola is a highly lethal disease that first appeared in 1976 in Western Africa. Blood interaction by humans with a virus-carrying primate is the most likely cause of the disease. Fever, fatigue, muscle pain, and chills are among the initial signs. However, the symptoms become lethal and debilitating, with internal bleeding resulting in vomiting or coughing blood. Ebola is transmitted mainly by contact with an infected person's bodily fluids or a person who has recently died from the virus. When infected by humans, one strain of the Ebola virus has an approximately 3/4 mortality rate. The most recent Ebola outbreak, which lasted from 2013 to early 2016, resulted in 28,646 cases and 11,323 deaths. The outbreak wreaked havoc on many West African countries, with up to 59% of those admitted to hospitals dying. Outside of Africa, there were only a few cases of the virus, including 4 patients in the United States who were rapidly isolated. Strenuous methods of touch tracing and quarantining were crucial in bringing the pandemic to an end. Owing to a lack of clinical trials at the time, vaccines were only used in a limited role to end the epidemic, although they have since been used to avoid many smaller outbreaks. Number 2. Smallpox. While many people associate smallpox with the age of discovery and the mid-17th century, the disease was not completely eradicated until 1978. The cause of the disease is unclear, but evidence from Egyptian mummies suggests it occurred at least as early as the 3rd century BCE. Small outbreaks continued until the disease was eradicated, but the last major outbreak in the U.S. occurred in 1902. Fever and vomiting are the first signs of smallpox, which are followed by ulcers and distinct blisters. A dent in the middle distinguishes these blisters, which are filled with blood. These blisters scab over and fall off, leaving scars behind. Some of these scabs have been preserved in time capsules, such as one discovered in a Civil War era book in the late 20th century. The last smallpox epidemic occurred in 1901 and lasted 3 years, resulting in 1,596 cases and nearly 300 deaths. The disease killed 17% of people, many less than previous outbreaks in less developed countries that went unchecked. The main explanation for the disease's eradication is the smallpox vaccine. Number 1. AIDS. Today, we know a lot more about HIV/AIDS and how it spreads, but back in the 1980s, we didn't know anything about the disease. HIV was first discovered in humans in 1981 in Los Angeles, San Francisco, and New York, although some scientists say it was present in humans as early as the 1960s. Scientists have discovered evidence of the virus's early transmission to non-human primates. There are many myths about HIV/AIDS, including the now debunked patient zero theorem concerning Gatton Dubis, a Canadian flight attendant. After the outbreak of HIV/AIDS in the United States in 1981, more than 700,000 people have died as a result of the disease. The virus was dubbed gay cancer because it disproportionately affected gay and bisexual men. Only sexual contact or blood contact with an infected person may spread the virus. Treatment for HIV/AIDS has vastly improved in recent years, with doctors increasingly using strategies to prevent HIV from progressing to AIDS in many cases. To combat the virus, patients may be given a drug cocktail of antiviral medications.